By the way, before I move on from investigations, when you go and see your doctor and complain that you are vomiting a lot in your pregnancy and you can't keep anything down, the first thing after taking a history, asking you about other possible conditions, the first thing that your doctor should do is to check your urine, okay, to dip your urine. Why is that important? Because that makes sure that it's not a urinary tract infection, which if you have a urinary tract infection, that can track up in your cervix into your womb and cause early miscarriage. So doing a urine test to rule out an infection is important. But number two is to also make sure that you do not have ketones in your urine. And ketones are a sign of starvation, okay? They're a sign that you are not eating, you're not keeping anything down, and you need intravenous fluids. The reason why you need intravenous fluids is to be able to flush out the ketones so that they do not cause acute kidney injury, okay? That's an important point. Okay, so you've now gone to see your doctor. You know, let's assume it's for the first time. You're having nausea and vomiting. You've not seen your doctor about it before. What should happen is that you investigated, all the needful is done. You should be given an oral antiemetic, also known as an anti-vomiting drug. Okay, then you should be sent on your way. I will very shortly talk about which anti-sickness drug should be tried first line. I will then talk about the second line anti-sickness drug and then the third line anti-sickness drugs. Okay, so you're given the first anti-sickness drug and it should be from the first line. You're sent home. You should go home, take the anti-sickness drug. And if you are lucky enough and it's just nausea and vomiting in pregnancy, after taking the anti-sickness drug, it will stop. You will have no further problems, okay? You should then be able to eat and drink okay. You should then be able to pass urine without any problems and then attend to your normal activities of daily living without any issues. However, if you are given this first line drug and you go home and the nausea and vomiting is not working, what do you do then? Okay, you go back and see your doctor. Remember, we are still only dealing with nausea and vomiting in pregnancy, okay? The vomiting is not excessive. You're not losing energy. You're not losing weight. You have no sign of dehydration and your blood, as was done by your doctor, were all normal. You have no electrolyte imbalance. So the first anti-sickness drug has not helped. Now, remember, some ladies will need a combination of anti-sickness drug if only treating them with the one single anti-sickness drug does not work. But on your second review with your doctor might not be keen to immediately start you on the combination of anti-sickness drug. He or she might decide to try you on a second line anti-sickness drug. Remember, I'm going to give you a list which are the first line, second line, and all of that a little later on in the video. So if the first one hasn't worked, you go back and he or she gives you a different type of anti-sickness. But remember, the second time, it may still be a single therapy. So he or she may still be giving you one single drug. Let's say you go away, you take it, and it is still not working. At this stage, you will go back and see your doctor for the third time.